I'm going to look you straight in the eye today, because if you have a heart problem, or high blood pressure, or elevated cholesterol, or if one of your parents has a heart problem, you need to know this information. I'm a cardiologist, but I'm also a medical advocate, and I encourage my patients to take responsibility for their health. Nutrition is a very essential point here. When it comes to the heart, you need to remember that this organ has to function 24/7. It must constantly generate energy in the form of ATP. If there's heart disease, the heart muscle is going to be depleted of nutrients. I call that the nutritionally starved heart. The pharmaceutical approach has been the gold standard for years, and with good reason. It saves lives, it alleviates symptoms, and it helps to keep people out of the hospital. But make no mistake about it, it does not replete the heart of essential nutrients. That's when nutrition is important. There are three very important supplements that I want to mention. I call this my holy trio. The first is coenzyme Q10. This is in the electron transport chain of the mitochondria. The mitochondria is the powerhouse of the cell. That's where energy is generated. Without coenzyme Q10, energy can't be generated. You also need to know that certain medications can deplete you of coenzyme Q10. Most notably, statins, commonly used to treat high cholesterol, and also beta blockers. The second nutrient is L-Carnitine. This transports fat from the cell into the mitochondria so that the energy can be generated. It's an important point because the heart depends on fat for 60% of its fuel. The third supplement is D-ribose. This is a 5-carbon sugar that is the energy substrate for the cell. You can have all the coenzyme Q10 and L-carnitine you want, but without D-ribose, the heart will never generate adequate amounts of ATP. I can tell you from my experience, patients can feel significantly better once they are repleted with these nutrients. It can make a big difference in the quality of a cardiac patient's life. But you don't have to be a heart patient to benefit. Anyone over the age of 40 could use more energy. And it also aids in your recovery if you work out a lot. Again, it boils down to being your own medical advocate, taking responsibility for your health, which includes nutrition. After all, it's your body.